Good morning, and thanks for the opportunity to present. Today I'm going to talk about the outcomes of PCOM aneurysms from the SVIN study. These are my disclosures. So Surpass flow diverter was developed to treat large or giant wide neck aneurysms, at the time not amenable to standard treatment due to location, morphology, and known treatment challenges. The device, as you know, gained FDA approval in July of last year to really fulfill an unmet clinical need at the time, because the technology at that point was only limited to treatment of petrous to hypophyseal artery segment aneurysms, namely the pipeline device. And the extra indications allow us to place the device in the ICA up to the ICA terminus, including the communicating artery segment. So the SVIN study is an international multi-center prospective single-arm study. And all aneurysms in the study were wide neck, large, or giant aneurysms. Primary safety endpoint: % of subjects experiencing neurologic death of major ipsilateral stroke within 12 months. The effectiveness is really strict. Raymond 100% occlusion at 12 months with less than equal to 50% parent artery stenosis. And for this study, we define PCOM aneurysms as carotid aneurysms locating between the PCOM and the anterior choroidal artery. So this is what we collected: basic demographics. In terms of the aneurysm size, and specifically the relationship of PCOM to the aneurysm, you can see a diagram on the right side, whether it be off the carotid itself, off the neck of the aneurysm, and off the dome of the aneurysm. Parent vessel size, the ICA, the P1, and the PCOM. What perforators are covered: ophthalmic, choroidal, and if the stent goes in MCA, the lateral lenticular strides of the MCAs. Look at reported the complications. In terms of outcome, these are outcomes we looked at: neurological outcomes, aneurysm occlusion, and also patency of the perforators, PCOM, choroidals, and ophthalmics, and so on. Okay, we'll move on to the results. Of 180 patients, about a fifth of them have a PCOM aneurysm, according to our definition. They're all sacral aneurysms, mean age of 63, and about 90% of patients were females. So as described before, these are mainly large and wide neck aneurysms. The PCOM mean diameter is 1.4 millimeters, notably a little bit smaller than the P1 on average. And about 30% of people have prior treatment, whether it be clipping or coiling. So it's interesting, if you look at the PCOM itself, of all the patients in this study, all the 38 patients, about half of them you don't actually see the PCOM on angiogram. For the remaining half, about a third of these people have a hypoplastic PCOM. And there's no fetal PCA in this whole cohort of 38 patients. In terms of where the PCOM originated, a little bit more than half from the neck and a little bit less than half from the ICA itself. Perforate coverage, as expected, almost all the choroidals are covered because of the proximity. About 75% of ophthalmics were covered, and of course less of the MCA. About 30% of the stents went to the MCA and covered the lateral lenticular strides. So what happened to these perforators? So if you look at the choroidals, out of the 35 choroidals covered, there's only one patient who went from a flow reduction at 6 months to an occlusion at 3 years, and the patient had a TIA on the first day after the treatment that resolved and had no symptoms since then. So really only 3% of all the choroidals cover went down over time. So the ophthalmic, as you would expect, is much more common. So of the 29 ophthalmic jailed, covered, 2 patients had a flow reduction and 4 patients actually had a complete occlusion on follow-up. And one of the patients with an occluded ophthalmic had a visual outcome, Aneurysms fugax, at 1 month after treatment that also resolved. So overall, about 15% of the cover ophthalmics either went down or became absent on follow-up. In terms of the lenticular strides, granted it's very hard to see these vessels, but when we look at all the angiograms, we didn't see any change compared to preoperative angiograms. So, and also no one had a deficit attributable to this vascular territory. The PCOM is perhaps the most interesting one. So of the 19 patients with visible PCOM, about 63% of them, 12 of them actually lost the PCOM at the follow-up angiogram, and an additional 3 patients had a reduction in flow in the PCOM. So a total of almost 80% of patients have a change in flow of their posterior communicating artery. And when we looked at it, most people lost that, or the flow went down in the first 6 months. And I think not a surprise to anyone, none of these people have any symptoms, from from the loss of the small posterior communicating artery. In terms of clinical outcome, technical success in all patients, 38 patients, an average about one device used per patient. The 12-month primary effectiveness, again, is a Raymond 1, 100%. Occlusion was 66%. And I just looked at the last follow-up data, almost 550 days of angiographic follow-up. It went up to 82%, as you expect for all flow diverter studies. The 12-month primary safety outcome was in 10.5% of patients, 4 patients, and actually 2 of them have an intraoperative complication. So in a small group of patients, unfortunately, with a few patients, you have a fairly significant number here. Even only a few patients have the outcome of interest. So just quickly, discussion, how does this compare to literature on PCOM aneurysm pipelines? A question of interest. So I looked it up. Complete aneurysm occlusion rate ranges from 27 to 84% of the pipeline device, and here with 82%, certainly in the higher end of the spectrum here. PCOM patency rates in the literature for pipeline and PCOM aneurysm is 23 to 77%. Ours about 40%, kind of in the middle of it. And again, similar to the literature, very low rate of choroidal and M1 peripheral occlusions, and of course, even lower rate of symptomatic occlusions. Strength of the study, the STEM study is a prospective multi-center core lab adjudicated study, so I think the quality of the data is perhaps higher than some of these other studies I just quoted, being retrospective. Limitations, it's not all comers, only the large and the wide neck aneurysms. We don't have any fetal PCOM aneurysms in the study, and there's some literature to show that the efficacy of this group of these particular set of aneurysms may be lower with a higher complication rates. And of course, we also don't have any PCOM arises from the aneurysm dome. So in conclusion, the STEM study demonstrated 12-month efficacy and safety of the Surpass device on large and wide neck PCOM aneurysms. The coverage of the anterior choroidal M1 lenticular striates are rarely safe, both angiographically and clinically. There's high occlusion rate of the PCOM, 63%, and the ophthalmic artery to a lesser extent, but they're usually not associated with any neurologic deficits because of the collaterals from the P1 or from the external carotid artery. Just want to thank all the site PIs and all the participating sites, and thank you for the opportunity again. Thanks.